Now, we have been asking for your health questions again today so that we can put them to Dr. Bharat Pankania in his garden near Bath. And I'm glad to say he is here with us now to give us his personal steer as an expert in public health. Always a pleasure to see you, Dr. Pankania.
Hello. Nice to see you too.
Right, let's dive straight in then. The first question we've got is from Elizabeth, who asks if she can give her friend a lift. They're both in their 80s. If her friend sits in the back of the car wearing a mask.
A good question, and these are the complex things that we're going to have to live with and deal with it pragmatically. So what I have been advising friends of mine who drive taxis and things like that is you must maintain cleanliness. Wearing the mask both ends is a good idea, and secondly, have a good circulation of air. You might find it uncomfortable, you might not enjoy it, but really you need a thoroughfare of air. So both sides of the windows open so that there is ventilation going on, and keep your distance. That would be a pragmatic approach to it.
OK, that's really helpful. Thank you. And we'll stay with masks, actually, because George, who's over 70, asks if he and his wife should reuse paper masks, even if they're only using them for a quick trip to the shops.
Unfortunately, these paper masks are not very sturdy and they are not very durable. That's the problem. And there are a lot of people out there making masks. I wouldn't ask people to go and buy surgical quality masks, but please have a look. There are many masks being made, and some of them in lovely designs. And what we really want is something that covers your nose and mouth, to protect you from infecting somebody else. And if that somebody is also wearing a mask, from them infecting you, that's the idea. So it's a face covering, absorbent on the inside, waterproofish and tight weave on the outside.
OK. Louise says she's been completely exhausted for the last 3 days and she's normally really healthy. She's saying, could it be a symptom of lockdown?
It may be. On the other hand, it may be other things. And we do know that extreme lethargy, tiredness, and unable to, for example, climb a flight of stairs, which they were previously doing easily, is also one symptom of a coronavirus infection. Therefore, I would say to Louise, look, take a careful assessment. Is this I'm fed up tired, or is this tired with something else going on? Think about it, and if you're not sure, ask your GP as well.
Yeah, OK, thank you for that one. Now, I've had loads of shielding questions. Dorcas from the Weston-super-Mare has a grown-up daughter who is shielding. She says there doesn't seem to be any kind of further guidance for people in her situation regarding the relaxation of rules, and lots of people have asked about this. Do I keep shielding?
If you are at risk, whatever the age group, you may be older and therefore you are shielding, or you may have other underlying conditions and therefore you are shielding, then please, the virus is still there. It's out there in circulation in the United Kingdom. The number of new cases is plateauing, but it is not going down, and therefore people can get infected. My advice is caution. Be careful and take all the precautions you've been taking. And then to answer your question finally, should I continue shielding? I think so. And if you need to break that shielding, go out and about very, very carefully and then return back home as soon as you can without doing all those dangerous things of hanging around with other human beings.
OK. Bernie's over 70, would like to know how long it might go on for after June the 30th. Could it be until a vaccine is found?
Yes, Bernie, and for the benefit of all our viewers and listeners is this. The virus is going nowhere. And this idea of shield for 3 months and then all will be well is also a wrong message. We need to shield for as long as the virus is out there in large numbers in the community. So the sooner we have a tighter lockdown, the sooner we have contact tracing and identification of cases, the sooner our case numbers will go down, the sooner we can return to normality. So the answer is we don't know unless we do the right homework. It may be a longer time.
OK, he did ask about going on holiday as well. Now, I've got to say, just a final question from me, Dr. Pankania. Can we have a quick look at your gorgeous garden? Because we get as many emails about it as we do health questions. So if we could have a lovely, gorgeous look. And please, may I come when this is all over and have a snoop around with our cameras?
You are all warmly welcomed and invited. It will be my pleasure.
Oh, because I know you take a lot of pride. You often tweet pictures of your garden, thankfully. Thank you so much once again for joining us, Dr. Pankania.
Thank you.
Take care. Bye-bye. I hope some of you enjoyed that, because you do email us about his garden, so hopefully we had a good look there.